example, they do fast, how does it impact their body and the health of the baby?
During the month of Ramadan, when I'm doing my OPDs, this is a very, very common question and very repeatedly question patient asks me, doctor, can I fast? Can I fast? I understand that this is a special month and everybody wants to fast, especially when everyone around you is fasting. And we suggest the patient better not to fast, especially if the patient is suffering from medical problems.
Assalamu alaikum wa rahmatullah. My name is Sadia. I'm a housewife as well as a student of Quran. Dr. Humera told me that you have to go under surgery to treat your fibroids, but I was a little scared. Would I be able to manage my rest of life normally, or would I do my normal activities just like before? But Alhamdulillah Rabbil Alameen, Dr. Humera did my surgery and it went so well that on the very next day of my surgery I was walking on my own, and even Dr. Humera was surprised to see me walking. And Alhamdulillah, I'm doing everything on my own now and feel more better, feel more confident than before. And not even I'm doing my routine, but I've started memorizing my Quran again. Thank you, Dr. Humera, and thank you, Zulaikha Hospital.
Hello and welcome to yet another episode of Doc Talk with none other than our specialist on women's health, Dr. Humera Bint Raees, Laparoscopic Gynae surgeon at Zulaikha Hospital, Sharjah and Dubai. Since it's the month of Ramadan, we want to focus on women's health in general, but pay a special attention to pregnant women. And in this regard, we will ask Dr. Humera a lot of questions, and since she is the expert, we'll take it on from here. Assalamu alaikum, Dr. Humera.
Wa alaikum assalam.
How are you? Ramadan Kareem.
Thank you very much. Ramadan Kareem and Ramadan Kareem to all.
So just coming to the point and to the very focus of our the topic today, Dr. Humera, can you tell us, there are a lot of questions women have on health in general, but when it is Ramadan, many pregnant women want to know, can they fast?
Yeah, actually Ramadan is a very special month, and if you are pregnant, it is advisable not to fast. Usually what happens, the women used to fast and their family, friends around them, they are fasting, and when they don't fast, especially when they are pregnant, then they feel they are missing out something. But remember, choosing not to fast is better for your safety in pregnancy and for the safety of your baby. Because if you are fasting, there could be certain risks to the pregnancy, like you feel low sugar more as compared to the other patients, and or other women. You can have a low blood pressure because whole day during Ramadan we are not drinking, and second, due to the effect of the pregnancy, there's more chance that your blood pressure can be low down. Apart from this, continuation of the fasting can lead to the decreased weight of the baby. It can lead that the patient may feel the less fetal movements, because when the patient keep on eating something, then the sugar goes to the baby and baby keeps on moving. For long fasting, especially in Ramadan, it is 14 hours fasting, so patient can have a less fetal movements. Similarly, there is a chance the patient can have labor pains, starting of labor pains before time.
But yes, I completely understand and agree, but many women do opt to fast. I know you're saying it is preferable not to fast, it is. But for example, they do fast. How does it impact their body and the health of the baby?
During the month of Ramadan, when I'm doing my OPDs, this is a very, very common question and very repeatedly question patient asks me, doctor, can I fast? Can I fast? I understand that this is a special month and everybody wants to fast, especially when everyone around you is fasting. And we suggest the patient better not to fast, especially if the patient is suffering from medical problems like blood pressure, sugar, or they're taking some special type of medications. Then we ask the patient, but patients still, sometimes patients say, no, we will fast. So fasting, how can it affect the pregnancy? As I have already mentioned, that during fasting, Patient may have a low sugar because they are not eating whole the day, and sugar in their body is going to be utilized both by mother and baby. So as compared to the normal woman, more chances that they will have the symptoms of hypoglycemia. Similarly, due to the physiological effect of the pregnancy, uterus on the body, the patient may suffer more chances of having low blood pressure, dizziness, and headaches. And then the continuation of fasting, because patient cannot eat a lot, like it's a 14-hour fasting, and after 14 hours, we are just left with the 8 hours in which we have to eat and drink. We have to complete the whole day what we are eating. And during those 8 hours, the normal woman can eat and drink to some extent, can cope with this. The pregnant woman, because the uterus is pressing the stomach, so she cannot eat at once more. She cannot eat and drink once more. So which predispose to the risk of urinary tract infection, because there is a deficiency of water in the body. And I'm facing more, the patients are coming to me during pregnancy with the urinary tract infections. And then there is a chance that the baby growth rate may be lower as compared to the other women who are not fasting. Patient may have a less fetal movements, and there is a chance of starting labor pains or abdominal pain before time if the patient is fasting.
So actually that brings me to my next question, for again just talking about women and fasting. So for example, the woman does feel okay and she continues to fast, maybe intermittently or something. Is there a special diet she can follow?
Yes, it is. Yes, I suggest the patients, when the patient come to me and they say me that no doctor, I want to fast, then I respect, their feelings. I say, okay, go ahead with the fasting. And in that situation, I ask the patient, okay, one day fast, one day don't fast. At the day you are not fasting, at least you can compensate. Especially the diet is the same thing. They have to hydrate well. They have to hydrate, because hydration is a very important part of the fasting. Their food should contain some part from all the 5 major components of the food. Like it should be fruits, it should be vegetables. They should try to avoid the spicy and especially fried and oily things, because these things predispose to the indigestion. And in pregnancy, due to the physiological effect of the pregnancy hormones, the gastric, the food in the stomach, it moves slowly. This is because of the effect of the uterus on the stomach and effect of the some hormones. So because of the slow movement of the food in the stomach, there is more chances they can have indigestion. And top of that, if we'll take like spicy, oily and fried things, which is a tradition of, I will feel, especially in the Asian culture, it's a tradition that iftar is never completed without having pakoras, without having samosas. This is a part and parcel. Their table is never an iftar table on which samosas and pakoras are not there. So eating such type of stuff can lead to the indigestion, and so better to avoid such type of things. Then take the carbohydrates, but not the simple one, like complex carbohydrates, like you can say brown bread, or you can say like potatoes, because from this the glucose is released slowly. And in pregnancy, there is a more chance of having diabetes in the pregnancy due to the effect of the pregnancy hormone. So already we are predisposed to having a sugar. If the patient is pregnant, she is already having predisposed to having a sugar because of the pregnancy hormone. And if she'll take directly glucose and all these things, simple carbohydrates, her sugar will rises in the body, which can increase her to the risk of diabetes in the pregnancy. Similarly, she should take the lean proteins in spite of other one, like you can say chicken without skin, or fish, or turkeys, because they provide the sustained source of energy to the patient during the whole day.
Doctor, so if the woman is still fasting and the situation arises where she has to break a fast, what are the symptoms she should watch out for?
Actually, Islamic authorities are agreed on this point, that if there is concern during pregnancy, and especially the patient is fasting regarding your health or your baby health, it's reasonable to break the fast. The symptoms which usually on which the patient can break the fast, like if she's feeling severe hypoglycemia, hypoglycemic symptoms will be, patient will be having severe headaches, she will have palpitation, she will feel dizzy, or if the patient is having Severe hypotension means decreased blood pressure. Again, in this situation, she will have headache, drowsiness, or if the patient is not feeling baby movements, again, this is very important because less fetal movements or less baby movements could be different reason. One reason is that if there is concern with the health of the baby. So in this situation, she has to break the fast. Or if patient is having any signs of like labor pains, in that situation, she has to break the fast.
So doctor, does fasting impact PCODs?
Yes, PCOD is a very, very common thing. Again, we are seeing in our OPDs in all age ranges, starting from the young till the middle age. And it does definitely, the fasting has a definitely positive effect on the polycystic ovarian disease. But if it is done in a proper way, like what it can cause, because whole day we are fasting, so our blood sugars are decreasing. Blood sugars are decreasing, in return the insulin's level are down. If insulin level are down, it has a positive effect on infertility or on the symptom of the patient. But if at the time of iftar, if you are eating all the sugars and all these things, then probably it may not.
So for women who have crossed the age of 35 and they have PCODs, for example, as you said that this is a very common problem, and issues that are related to PCODs due to hormonal changes. So please tell us when a woman should visit a doctor in this case.
Actually, patient with the polycystic ovarian disease, they present with the broad range of symptoms, and sometimes patient come to us, they are totally asymptomatic. But the some symptoms on which the patient should worry and should come to the doctor include, like if they are feeling the excessive hair growth on the face or excessive hair fall. Some patient can have acne more than usual because the hormonal changes in the polycystic ovarian disease can cause this acne. Or if the patients are having, they are not getting their periods regularly on time, periods are getting delayed, or if it's difficult for the patients to lose weight, especially when the other hormones test has been done and they are all normal and still they are not losing weight. And if the patients are getting difficulty in getting pregnancy, then they should consult the doctor.
So how does a woman get to know? Is there a test for PCODs? What should she do?
Yeah, for the polycystic, it's not basically, it's polycystic. This is called, it's a combination of clinical findings, the blood test and ultrasound. Okay, out of in the clinical findings, in the symptoms, what the patient can have, again I'm telling you, excessive hair growth on the face, they have their periods are not regular. If the patients are having these symptoms, or second on we do the hormones test, the disturbances in the level of the hormones, and third one is the ultrasound is showing us polycystic ovaries. So out of these three, if two things are there, we say patient is having polycystic ovarian syndrome. Polycystic ovaries per se is not a thing which worries the patient, or we don't say it's polycystic ovarian syndrome. Out of three things, like the symptom of the patient's hormonal imbalance on the blood test, and the third thing to find on ultrasound polycystic ovaries. Out of three, if two things are there, we say the patient is having polycystic ovarian syndrome.
I see. So what should women do, or what are the tips to avoid this problem, the hormone change and all that?
Yes, the polycystic ovarian, as I told you, the polycystic ovaries only finding on ultrasound doesn't harm the patient if their hormones levels are normal or if they are not having any symptoms. But if the patients are having symptoms and all the thing, it is very important because this disease is very much related to our lifestyle. Like you can say that the patient should have an eye on the weight. They should do exercise daily. They should take healthy balanced diet. Again in the diet, they should take the complex carbohydrates because it causes the slow release of glucose, which will not increase the level of insulin suddenly in the body. Apart from this, they should keep an eye on their weight, and they should, if they are overweight, it should be decreased. If they are within the normal range, it should be maintained. So if these lifestyles are going to maintain, it is very, very fair chance and a very good chance that the patient can come with the symptoms of the polycystic ovarian syndrome.
Right. Thank you for that, doctor. I'm sure very many women connect with that because it's a very common kind of complaint, and you're the expert, of course, you know about it. Right. So, doctor, coming to general health of women, we have been talking about. There are so many stages in the life of a woman, where her body changes. There's so many physiological changes. So how should she be prepared for them?
I will say there are many stages of life in our body, starting from infancy, and second one is the puberty, third one is the adult age, and fourth one is the old age. Regarding infancy, I will say this is not a problem on our part, because when we are small, we don't know. It's our parents who take care of that. So when we become conscious and all the things, that basically start from the puberty or adolescence, what we say. In the puberty and adolescence, suddenly what does changes happens in the female, like development of the secondary sex characters. Patient may have acne, breakouts. Patient may have irregular periods, because when the period starts, these are usually not regular. It takes time, our system to get set. Then some girls, they are coming to us in the OPD with the weight gain. They are not controlling their diet. They don't know, because they are not conscious about themselves. They are just entering into the in a age. So they just keep on eating snacks, and it's a high caloric food. When they become little conscious later on, then they think, no, we should maintain. But when they entering, then next come the adult age. Adult age, we all are very sensible. We know what it is not. Again, the problems what we can face in adulthood is like again the weight gain. Again, it's very problem which I am facing. Usually patients become pregnant during pregnancy. This is concept in our countries, to eat a lot for the health of the baby and them. If they will eat, baby will be healthy. So they put on the normal weight gain in the pregnancy should be 12 kg from 0 to 9 months of pregnancy. I have seen minimally we start 20 kg weight gain, 25 kg weight gain, and after delivery, our females are Asians. They take care of their baby, they take care of their husbands and all the things. They don't, take care of their health, so they don't lose weight. In the next pregnancy, again they enter with this baseline more weight in the next pregnancy. So the thing in the adult during this period, they are overweight. They can present with the bleeding problems, they can have bleeding problems, they can have abdominal pains with the periods, could be due to the different medical problems like fibroids, endometriosis, and in this time patient also can get difficulty in getting pregnancy. These are the things they should consult the doctors if they are facing these problems. Then it comes the late age or old age. This age is also very special. Patients come to me and sometimes they say we are feeling, like they are just getting depressed a bit, that we are getting old and this and that. I always tell them, enjoy the time what we have. We are now, in our old age, and our periods we have to say bye-bye to the periods. Enjoy this time. This time is also good time. So usually patient, if their periods has been stopped and they are bleeding in this situation, they should not sit home and they should go to the doctor, because this is very much area of concern, especially if periods has been stopped and they are sitting at home because of shyness in our culture. Our mothers, our grandmothers, they will not tell us, they will not come up immediately if they have little bleeding. They feel shy. So in this situation, whenever they usually come to us, usually because if your periods has been stopped and you are bleeding, there is a 10% chance that you can have the cancer of the womb. And believe me, I have detected 3 patients in the past 1 year. They came to me and I did their test and all the things. Finally turned out to be it was a cancer of the womb, but it was detected early because patient was a bit educated, so she came. So she came to us and we treated it timely, and patient doesn't require any radiotherapy, any chemotherapy, nothing. So the postmenopausal bleeding, if you have bleeding, please come to the doctor. Then sometimes the patient have hot flushes, they have low mood. Again, they think the hot flushes and all the thing, because in this age usually blood pressure, these medical problems are common. They think this is because of that. They think they cannot differentiate. No, these are not related to sometimes blood pressure and other medical or metabolic problems. These are related to the hormones, and if you have these symptoms and they are bothering you, please come to the hospital. We can give you some therapies which can alleviate these symptoms.
Actually, you're touching a very important point, especially in certain cultures, like you said, Asian cultures. Women close up, you know, they don't open about, they don't want to talk about these issues. First of all, they don't accept it, and they don't really want to talk about it. So it's important that experts like you tell women that this is perfectly normal, this is okay, this happens with everyone. This is a physiological change that, you know, every woman will go through, and they have to come to terms with it, basically, right? So doctor, thank you for explaining that, but just a little question on, you said you know, postmenopausal bleeding. Since the periods women bleed, so how will a person, you know, a woman differentiate between have a period stopped, or is this normal bleeding, or isn't it a normal bleeding?
Usually in the perimenopausal age, initially what happened, the usual age of the menopause is 51 years usually, but some patient can have menopause 1 to 2 earlier, before the 51, and some patient may have it beyond the 51. Usually when the periods are going to stop before the patient is having a regular periods. Usually when the periods are going to stop, in majority of patients, I'm not talking 100%, what happens, initially the periods comes every month. Then there is a spacing, like patient will not get periods every month. It will get every 1.5 months, 2 months, 2 months, 3 months, 3 months, 6 months, 6 months, and then finally it will stop. So patient is not getting period for 1 year, completely. We assume, and especially patient is in the age range where it is menopause, we assume that the patient is having menopause, but again it should be tested with the hormone test to make sure this is menopause. And apart from this, sometimes it's not maybe due to the menopause, hormones level are normal, but still 1 year of over the whole year not getting a period, and then suddenly coming period. In this situation, patient should not overlook. She should go to the doctor for evaluation, especially in this age, to rule out, is it due to some other reason it was stopped, or was it is a menopause. And if it is a menopause, then bleeding started, then it must be investigated.
Right, right. Thank you for that, doctor. This brings us just to the last question. This is about conception. If a woman is trying to conceive, so what are the various issues she might face, and what are the options available for her for these problems, especially when she's trying to conceive?
Infertility, again, it is a very sensitive issue and very commonly presenting the patient with these problems in our OPDs. There could be different reasons for infertility, like there is some sort of hormonal imbalance, like polycystic ovarian disease. Apart from this, there are some other reasons for which, due to which the patient cannot conceive, like fibroids uterus. These are the non-cancerous tumors within the womb, or the patients having endometriosis, or the patients are having, you know, you can say, like if they are overweight, this is also one of the reasons, difficulty in getting pregnancies, and or if they are having some growths within the womb. Actually, it is within the womb where the baby implants. If at that place, if some growth is there, it will not allow the baby to implant in the womb. This is also one of the reasons the patient is not getting pregnant. In this situation, there are different treatment modalities ranging from the medical treatment to the surgical treatment. In the medical treatment, if patient is having hormonal imbalance, we ask we correct the hormonal imbalance of the patient, like special hormones which are related to the fertility, or the thyroid hormones, or the milk hormones. In the polycystic ovarian disease, the hormonal imbalance happens. So we treat it medically if this is a cause of infertility, and we have seen very positive results treating these things. The patient usually gets pregnant. Then apart from this, the other problems which the patients, like fibroids uterus, like ovarian cyst, in this situation we have very modern treatment modalities, like we remove them laparoscopically, which is also known as a keyhole surgery, which is a scarless surgery. Patient is not having scars. You know, in this age the patients are concerned, they are concerned, yeah, that is my area of expertise also, that there should be no scars. Yesterday I was doing one surgery. The patient was having a 12 into 14 centimeter big ovarian cyst, and it was two cysts. One is 12 into 14 centimeter, otherwise 5 into 5 centimeter, and it was not a simple cyst. It was a endometriotic chocolate filled cyst, and the patient was about to marry, you know, after 1.5 months. and she especially requested me, doctor, please do my cosmetic surgery. Usually I don't then I put her little main incision in the navel region, because in the navel region putting incision, later on it will not be visible. So especially requested me. So this is the advantage of keyhole surgery, that it's a scarless surgery, patient has a less pain, early return to normal activity, early discharge from the hospital, and less chances of surgical adhesions after surgery. So less adhesion, less chances of fertility in the future. So we remove these fibroids, ovarian cysts with the keyhole surgery. And then if there is some growths within the womb where the baby implants, then we do the hysteroscopic procedures. What are the hysteroscopic procedures? This is again it's modern modality that through camera we enter into the womb from the down, and we remove those growths. And I would like to mention one patient. She was a dentist and she was not getting pregnant. Age was 39 years. And she has tried everything. She was having this growth in the womb. So usually I don't touch these things unless I have tried all other things. So finally we decided, okay, we have done all the treatment options, medical treatment. This is the only thing left, so let's remove it. And the month I removed, 2 months after that the patient conceived. And you know, these things can affect. And again, all these procedures are scarless procedures. And we offering these modern treatment modalities and to the patients, and I'm very happy to tell that they are having a very positive effect on the patient in terms of their infertility.
Right. Thank you so much, Dr. Humera, for sharing those success stories. It makes a lot of difference to women who are listening, and I hope they do listen and they do understand and follow instructions that you have been we have been discussing here. Thank you very much for all of you for listening, and I hope you have taken your notes from this educational talk that we had with Dr. Humera. If you have any additional questions, please put them on the social media posts or comment under this video, and we'll take them up with Dr. Humera. Until next time, Allah Hafiz and Ramadan Kareem to all of you once again.